the Point with Michael Williams.
Good morning and welcome. Coronavirus, the Florida, Palm Beaches, and Treasure Coast impact. That is our exclusive focus today, and we are streaming on all of our online platforms as well, WPTV.com, Facebook Live, and more. With us to talk, an infectious disease specialist who at the bottom of this hour will take your questions on Facebook Live. First, though, a familiar face, Republican Congressman Brian Mast. Thank you for being with us, representing the Treasure Coast and parts of northern Palm Beach County. You come back from the House, where the House has just passed a $40 billion plus emergency aid package. A national emergency has been declared. For our viewers in the Palm Beaches and Treasure Coast who are worried about what they're going to do for childcare, they're worried about small businesses, they're worried about layoffs, how am I going to make ends meet? Very specifically, talk about what the aid package intends to do for all of our viewers listening today who are worried about hard times ahead.
Sure. So some of the biggest top lines, right? Number one, about $1.2 billion for increased testing divvied out amongst all of the states. Go down to what we're talking about for individuals that are working, worrying about their kids, possibly staying home from school, you name it. So there's provisions in there for paid family sick leave. These are paid for, and not just that, but family leave as well, whether you have to take care of somebody or whether you yourself might be suffering from symptoms, you don't want to go out there, or you test positive for this. What those provisions include are if you're helping somebody that's a member of your family, up to $200 a day and change to assist you, or up to $500 a day, up to, if those are your wages in terms of individual leave. Now, employers might be asking themselves, how do I pay for that? I can't go out there and just pay for somebody to not be working that way. The way that this occurs is through every employer and employee pays what's known as the payroll tax. So through the payroll tax, which is 6.2% for the employer, they will get a credit towards that for any dollar that is spent towards putting somebody on that kind of leave, a direct credit towards that, so that that's not a cost that they have to bear directly out of their pocket.
So again, 2 weeks of paid sick leave, up to 3 months of family and medical leave if you need it. And again, you talked about the tax credits for small and medium-sized businesses. For those watching who say, how do I cut through the red tape and get access to that money, which I may need more rapidly? All of us, I'm sure you are. I certainly am hearing from people already in danger of losing jobs in the service economy that so much buttresses our tourism economy. How do we cut the red tape, and how quickly will people be able to easily access that kind of help and get that money in their pockets?
The goal, as quick as possible, right? Obviously, this is something that's going to be going through the Senate on Monday. I was in Washington, D.C. We passed that bill through the House of Representatives on Saturday morning, about 12:30 in the morning. Senate has yet to pass this. It will go to the president's desk immediately, and will immediately, as the president signs it, which will probably sometime Monday afternoon, will be divvied out and start heading down towards the states, not just in terms of those programs that we just spoke about, but also in terms of additional resources for Medicaid, for programs like women's, infants, and children, SNAP programs, children's health insurance program, all these programs, there are provisions in there as well.
Again, though, people will wonder when the money starts flowing. Red tape, of course, is the bane of reacting quickly in a crisis.
Bureaucracy.
Where will people say, I can easily go? Where will your office, for instance, say, okay, if you need the sick leave, if you're an employer looking for the tax credits because you're having to let people off and you need to keep your business running, where specifically will they go? What infrastructure will be set up that will make that as seamless as possible and as fast as possible?
So number one, let me just start with my office and say my offices remain open for any people that have appointments with us or want to speak to us or have an appointment. We offer a number of different options, as we always do. If you still feel that there's absolutely a need to meet with me in person, we'll still meet with you in person, but there's always an option to Skype with me, to get on a phone call with me, or from somebody from my office, whether it's in Washington, D.C. or down here in Florida. All of those resources will still be out there. So for employers that need help dealing with that bureaucracy, with the IRS or with somebody else, reach out to us. Let us know how we can assist, what we need to explain to you in terms of payroll tax credit, working through the IRS on that front. But that is directly where the employer doesn't have to reach out for a dollar to say, this is where it's going to go. It's going to come through the payroll tax credit and being offset in that way. So what they would normally have to pay for tax, they now will not have to pay for tax. It will go towards this.
What are we looking at in terms of extended unemployment benefits?
So in terms of unemployment benefits for individuals, you're not going to have to go out there and show that proof for some of those programs where you normally have to show where you are employed. You no longer have to go out there and show those proofs during this virus. For those programs like WIC or SNAP, some of those other programs that I mentioned, you don't have to make those proofs.
Help with food benefits.
Exactly, for those food benefit programs.
Congressman, you've been getting briefings all along. How bad is this going to get?
So I can't give you the prediction of exactly where it goes to. I can give you numbers.
I'm talking both health-wise, and we'll have an infectious disease specialist, and we're online right now, and we'll be taking questions with him on Facebook Live at the bottom of the hour, I want to reiterate. But first, let's take it from the health component, your sense, and we'll talk to him about that, but also the economic component of people saying, how long? How long are we going to deal with this and hunker down or have to like this with the economic cost as well? First, the health side.
Best I can give you from my sense based upon conversations with CDC or state surgeon general or emergency management individuals, right? Important to point out, this is not smallpox. This is not Ebola. It's absolutely worse than the flu, but it's not those things. So when we talk about this, we all need to be doing the same things, whether we've been tested or not having those congregations with individuals, not making sure that we have better levels of hygiene. Restaurants are holding themselves, or hotels or any place like that, holding themselves to the highest possible standard. But let me put something in terms of numbers for you, right? I think one of the best things to point at is the numbers of mild versus serious cases worldwide. Now, bear in mind, I'm not going to tell you that I believe every case is reported. Not everybody has been tested. We can talk about some of those things, but based upon the numbers that I have, in the U.S. right now, 2,930 cases nationwide. Of those, 2,920 are considered to be mild. What does that mean? It means they're not behind a plastic tarp, they're not in ICU, they're not on a respirator. They're individuals that are self-quarantined in their home with maybe worse than flu-like symptoms, diarrhea, shortness of breath, certainly different, but other things going on like that. There's a very small percentage that are quarantined in an ICU that are facing very dire circumstances right now. That's a difference.
Yeah, of course, we worry about the elderly. I have elderly parents. And
my father's 90.
My dad will be 89 soon. My mom's 85, so certainly it comes home to us as well. We do know that most are mild or moderate cases, and yet worst case scenarios say perhaps worst case up to, I've heard reports of, you could see up to 1 million, everything from 1 million deaths to something lower than that. Numbers are all over the place, but all of this comes back to a central question about how could we have bollocksed the testing rollout. And there's been severe criticism about the rollout of testing, and to this day, most people don't know how they could call their doctor and easily get a test. When we hear 15,000 tests a day being done in a place like South Korea in drive-by fashion and state by state here, it seems a very decentralized, very haphazard response on testing. Why have we failed on that?
So I think, number one, let's talk about the genesis of this, right? Started sometime in December in China. They made every effort to keep it away from the eyes of the world and their own people. That's how it advanced to 80,000 people within China alone in the case of about a month. The U.S. wasn't really able to go out and start addressing this until early January. World Health Organization finally identifies it as pneumonia-like symptoms. Beginning of February, President says people aren't going to travel in from China.
The CDC
move forward, right?
First batch of tests, for instance, that had to be redone.
Get to that testing, right? Right now, testing in the state of Florida up to 300 a day, maybe closer to 500 with LabCorp doing their tests as well, but Florida Department of Health up to 300 a day. That's going to advance by next week to about 5,000 a day capability in the state of Florida. State of Florida purchased about 625,000 tests. So why can somebody get tested? Then that's important to say how many have tested when you ask why such a low number. So it's not as though anybody's going to go into their doctor and say, I just have anxiety, I'm worried, can you get me a test? The answer is probably going to begin to be no. They're going to say, okay, do you have a fever? Or do you have shortness of breath? Or do you have any of these other flu-like symptoms? If not, they're probably not going to identify you. Have you come in contact with somebody that is a known carrier? Have you been traveling to one of these countries? You're going to have to meet that profile to get tested, and that's where you see those numbers of who has been tested.
And we will look at that in containment. The bottom line is, though, we don't know, and briefly here, as we want to get our infectious disease specialist in, we don't know how long we're going to be looking at the economic fallout or the health fallout here. We just don't know.
Of course not. With supply chains, with non-travel, it's important that we don't have that. We don't have, we're limited limiting that travel. But yes, unknown effects into the future, no question.
And we, in our next segment, I was going to do it here, but we'll put up the number of cases in Florida in our next segment and symptoms. Do have to ask, there is the political component. The president being praised by some, being criticized by many others for lack of leadership. One quote, he's repeatedly made statements about efforts to combat the virus that are wrong, said one editorial writer. Even as testing was severely limited, he said anyone who wants a test can get one. Hasn't been true. He's just suggested the country was very close to a vaccine, despite evidence that health experts say it's a year away. He said he'd closed travel from Europe the other night, even though Americans and legal residents were exempted, and that caused a hiccup for a while in the markets. Some are arguing that the president did not take it seriously enough, early enough, and to those who say you're making it political, in 2013, this was a president who said of Barack Obama, when you're in leadership, it's on you.
Yeah, when you're a leader, you lead, no question.
Has he failed in some aspects in his leadership?
Look, I think there's been hiccups in messaging, no doubt, but let me talk to the policy and where it's totally different from where it would have otherwise gone. And I don't want to have a hyper-political conversation, but I have to frame this in terms of Pelosi, Schumer versus President Trump, right? So he cut off travel from China. The immediate response from them was, this is xenophobic, you can't do that. The biggest worry was, how are people from China going to feel about being profiled in this way? Not, man, you're doing a good thing for the citizens of the United States of America, considering this is the origin, the ground zero for this. That wasn't the consideration. It was a total making sure that they're politically correct response instead of let's just do what's best for the American people. So when you're asking, do I think that the president has been strong enough on it? I think absolutely yes. I think he's been far stronger than we would see from whether it was Pelosi or Schumer managing this situation. Could some things have gone smoother? Absolutely yes. Do I think this is an important learning lesson as we go through this for what happens when you cut off travel from nations or from an entire continent, or when you have to ramp up testing for something that has never been seen before in this kind of way? For our emergency managers moving forward, very important. I think you'll be able to see a lot of after-action review on this, but no, I think that the president has done things that would be unseen by anybody else.
Obviously, the Democratic response would be different to that, but as you said right now, the first and foremost concerns about health, and the bottom line is that people can get in touch with offices like yours if they have questions about cutting the red tape to get the kind of aid that so many people are going to need in the weeks and months to come.
They 100% should. We'll still be in our office. Reach out. They want to speak to me directly or anybody else in my staff. We'll help them every step along the way.
I'd shake hands, but I guess we want to show good protocol.
Congressman
Congressman Brian Mast, we'll have you back. Thank you for giving some perspective. We appreciate it. And coming up, the latest on the coronavirus, its impact, and our infectious disease specialist next. And for those of you with us online, we'll put up a slate, but we'll be back in about 2 to 3 minutes. So just stay right with us. We're going to commercial break. You'll see a slate up. We'll be right back. The coronavirus, a global pandemic now hitting the United States. As the outbreak changes and impacts almost every facet of our society, leaders across the country banning public gatherings, school closings, universities going online, sports leagues suspending their seasons. Today, we're talking to a doctor about symptoms and how to protect workplaces and family. Now we welcome to the Point Dr. David Dotson, infectious disease specialist. We are streaming our coverage online. At the bottom of the hour, Doctor, you'll be taking questions on Facebook Live. We're on ptv.com, Facebook Live, all of our streaming platforms. First, let's just quickly throw up numbers, the latest numbers from the Florida Department of Health, if we may. In Florida, if we can put up that graphic, we have a total of 115 confirmed cases. Palm Beach County, 5. Floridians who have died because of coronavirus, 4. Testing right now, 1,400 people statewide, just to give you a sense of that. And again, those are the very latest numbers we have. We've not seen anything pop up on the Treasure Coast in terms of numbers. Doctor, to all of our audience watching, you have so many questions and concerns. Give an overview of what are the most important points you want our audience to know about right now.
Well, thank you, Michael. Thank you for having me here.
Absolutely.
We've actually all been hit with quite a lot in the last couple of weeks. On January 20th, the first case in the United States was reported. On February 29th, the first death was reported. Now we have thousands of cases in just about every state. And then all of a sudden our lives have changed. Sports is gone, venues are, all the activities, museums, schools, everything is gone. And so we're all feeling a little disoriented right now. And
help orient us.
And that's perfectly normal. So what's interesting is that, unbeknownst to all of us, we've just been enlisted as privates in the Army against the coronavirus. Because what you're going to see as this epidemic evolves is you're going to get you're going to get acquainted with two terms. One is called flattening the curve, and the other is called surge capacity. So what's happened is when you see a curve of the incidence in a population, it's going to go up, and then eventually it'll go down. That's what's happened in countries that are ahead of us. So what people need to understand is that it is critically important that each of us, every single one of us, our behavior will determine the height of this curve.
So what should we do in terms of our behavior? I mean, we're seeing, of course, events being canceled, people staying at home, people, frankly, in some cases, we've seen store shelves emptied. There's no need, supplies are flowing, but nonetheless, what specifically do you want to tell people today about what we need to do and continue to do so we don't see this huge spike in cases, that we can at least flatten the curve, as you said, in terms of transmission? What is your best message to people at home? And also a lot of people saying, but for how long? So answer those two questions to the degree you can.
Yeah, so the best message is that understand that if you're not in close proximity to somebody who's coughing or sneezing and infected, and you don't touch something that has been contaminated with the virus, you won't get it. So all of these social distancing, cover your cough, wash your hands, don't touch your face, all of these are critically important. And if you stay at home and aren't in contact with other people, you won't get it.
People saying we're seeing different scenes from the new normal, at least for the moment. Some empty store shelves, a lot of them, although they are refilling. Airlines are being hammered, sports venues, you see the footage there. People are saying, but for how long do I have to do this? We can't, I've had people say we can't shut the country down economically forever. So there becomes the health component versus the economic fallout that can create its own health issues. So how long do we ride that dividing line?
Well, the problem is it's going to be weeks to months, because, and what we're going to see in the United States and in Florida is with wider distribution of testing kits, all of a sudden the numbers are going to shoot up.
People are very concerned and in many cases frustrated about testing. The congressman talked about more testing. Some have been supportive of that and that it's going fast enough. Others have said it's been a critical failure. In terms of testing, what's been the problem thus far? How quickly do you think we can ramp up?
Yeah. It has been a failure. And so it started with the 2008 fiscal crisis, and public health and CDC were defunded. Those cuts were never reinstated. And in 2018, Congress did give an increase to public health, but it's not enough. And so our public health system was already stretched thin, and now we're getting hit with this thing. So it's really a matter of, it's kind of like if you look around and you don't see a fire in your community, you can say, okay, let's shut down the fire department. Well, the way it works with epidemics is that you have to have people in place who are ready to respond to a pandemic quickly, and then you'll have all the test kits that you need.
The president, who has his supporters and his detractors on his response, and that can be for another day in some ways, and that's not your bailiwick, but nonetheless rolled out corporate chieftains the other day from companies who say they're working on rolling out test kits, working on making sure that people have enough tests available. How quickly can we ramp up testing in your mind to get it where it needs to be, to get at least a handle on the scope of what we're dealing with? First, that question.
I think it's going to take a couple weeks to get all the test kits distributed, and then once people are tested, it takes days or so to get results. So,
but it's critical that we have a better grasp of what we're dealing with.
Absolutely. So a principle of epidemiology, an epidemiologic principle of epidemic control is you have to isolate, you have to find the people who have it, you have to find the people who don't have it, and you have to keep those two groups apart. So everybody should be tested. What we're saying is you can't have a test for this or this. Well, everybody should be tested, period, right now.
But you think it's weeks away before we get anywhere near everybody being tested?
Yeah, because we have a shortage of kits, we're going to have to test the sickest ones first. But ideally, we'd want to know everybody.
And that goes to your argument that while we're trying to do that, we need to try to flatten the curve of the number of people exposed. Therefore, the social distancing we're going through, the vast shutdowns we're seeing, nobody can really answer how long we're going to have to deal with that in both the health component and economic component.
Yeah, so there's two curves. One is going to be the number of cases, but followed that, there'll be a shorter curve, a lower curve of mortality, people dying.
What are you saying? We're going to continue our conversation online so that you can take viewer questions, but what do you say? We hear people either say, this is being hyped. We either get that or people who are scared to death. And people are reading numbers and cherry picking information. What is your sense of frankly, how bad this will become and what our response needs to be right now, especially since without enough testing, we don't yet know the full parameters of this.
Right, so this has probably been spreading in our population undetected because we don't have test kits, but it's a serious thing. People will die because of this, and the only variable is how many people will die, and that depends on what we do.
It is fair to say, though, that for the overwhelming majority of people, we've seen children have very little impact globally or here. That's fair.
It is, I've talked to 20 and 30-year-olds, and people say, okay, well, if I get the virus, I'll probably be just fine. The problem is that if they have the virus before they get symptoms and they go visit their grandma, they might kill her.
It is primarily something of grave concern, potentially, and I have elderly parents myself, so I certainly feel that. That's where the primary concern is, but we all play a role in mitigating that spread.
Absolutely, and each and every one of us. And the one thing I will say is that as we all go through this, it's very stressful, but just be kind to everybody. You know, just look out for your neighbor.
Well, we're going to take a lot of questions here. We're going to go to a break for just a moment. We'll be back to finish off on air. Let me again say to you, if you're with us online, we're going to go to a slate for a moment as we go to commercial break on air, but we're going to take your questions on Facebook Live seamlessly as soon as we're done with To The Point on air. We'll be back with our closing comments in just a moment. On air and online, we continue. I've been joined by Congressman Brian Mast, both on air and online. And again, we're starting to get a lot of your questions in from Facebook Live. Dr. David Dotson, infectious disease specialist, if we can perhaps show him in our cutaway shot here, will join us and stay with us here. We'll come back to him in just a moment. But we thank you for spending time on today's To The Point. But our conversation continues. Stay with us on our streaming platforms, the WPTV app, Roku, Apple TV, Fire TV, Facebook Live, where we have much more coverage. We're already getting a lot of your questions for Dr. Dotson. And by the way, we invite you this Tuesday, March 17th, to join us for a special edition of To The Point at 7 p.m. on the Florida primary day. Much more coverage for us. Send us your broadcast comments whenever you like. And again, stay with us online right now as we seamlessly stay online to take your questions.